Hello and welcome to today's webinar organised by the Pathologist and mTuitive. My name is Fedra Pavlou, SVP and Editorial Director of the Pathologist, and it gives me great pleasure to be the moderator of today's online event, which will explore why automating lab inspection readiness is the next big push in pathology. Please allow me to introduce today's speakers, Dr. Mazzotta and Daniel Faasse. Dr. Mazzotta is a certified pathologist assistant, and for the past 33 years, he's practiced at various institutions, from small community hospitals to large academic medical centres to high-volume reference laboratories. For the past 14 years, he's been the manager of surgical dissection at CLIA Labs, headquartered in Brunswick, Georgia. He's on the medical staff of 8 hospitals and is a member of several professional organisations in healthcare quality and pathology. In addition to his laboratory duties, Dr. Mazzotta frequently lectures and performs anatomic laboratory consulting work around the US. It's a real pleasure to have you with us here today, Dr. Mazzotta. And hello to our second speaker today, Dan Faasse. Dan is a certified pathologist assistant with over 3 decades of experience at the bench, pathology resident training, and lab management in multiple settings, ranging from community hospitals to private labs to academic medical centres in the Philadelphia and Boston areas. For the past few years, he's been working with commercial organisations in genomics, oncology, and biobanking as a liaison between healthcare teams and corporate medical affairs. Today, Dan serves as product manager for mTuitive's quality suite of lab software solutions. A warm welcome to you both. Today, our speakers will discuss why it's beneficial to automate as many laboratory processes as possible. They'll share the best practices encouraged by multiple international organisations, and they'll explain how to avoid a lot of the stress and the penalties that come with a lab inspection. They'll both be on hand to answer any questions that you might have at the end of this presentation. But please remember that you can submit questions at any point throughout this webinar. So, without further ado, let me get today's webinar underway, and I would like to pass you on to our first presenter, Dan. Dan, over to you.
Thanks, Fedra. I'd like to welcome everyone to the webinar. This is Dan, the product manager at mTuitive here on Cape Cod, and we're thrilled to join the pathologist in sponsoring this discussion with Dr. Mazzotta. As laboratory professionals, for all of us, formal lab inspections are, at a minimum, a biennial opportunity to raise our collective blood pressure. And no matter how well we do our jobs day in, day out, the open inspection window is certain to increase our anxiety level, at least a little bit, even in the most seasoned lab director. Both Dr. Mazzotta and I have years of experience, primarily in an anatomical pathology setting as PAs, and we've both been through numerous inspections as inspected and as inspector. In fact, I can remember my first inspection as a PA once I finished graduate school. The lab inspector emerged from his office on the first morning of the inspection with a brand new white gleaming lab coat that I had not seen him wear prior to that. He had always worn a kind of grimy, rumpled, wrinkled lab coat with coffee stains, and here he's been transformed into this gleaming new lab director at the last minute, which I think is often the way we do things with lab inspections, is try and get them done as quickly and as last minute as possible. There is going to be some of that element involved, no doubt. But one of the things that we've noticed is a trend over the years away from cramming for an inspection as if it were a final exam for a required course in college, to an ongoing process that emphasizes education, sharing of best practices, and quality improvement on behalf of patients we care for. So, material presented in this webinar will be geared toward providing general information, anecdotes, and insights based on Dr. Mazzotta's experience, and we hope this discussion will give you helpful and pragmatic advice, especially for those of you who may be facing your first inspection. or perhaps more importantly, your first inspection as a lab manager or a department supervisor. I'd like to give you a brief history of mTuitive so that you have some context as to why we are so excited to partner with the pathologist to present Dr. Mazzotta's talk today. mTuitive was founded in 2003 by a pathologist, Dr. William O'Toole, as a very small startup on Cape Cod in Massachusetts. Dr. O'Toole foresaw the critical role structured data could play in the practice of pathology. He'd been trained in academic medicine and research at Hopkins and Harvard and practiced pathology for many years in a small hospital in the Cape. So he thoroughly understood the need to use diagnostic data to improve the practice of pathology. He also understood that to a great degree, the practice of medicine required the pragmatic methods one sees in running a small business. I'd like to show you a quick example of how his innovative thinking fundamentally changed the way cancer diagnoses are reported. Those of you who work in the clinical side of the lab are very familiar and comfortable with data-centric test results and reporting, illustrated by the row and column diagram that you see on the screen. Your ranges can be defined numerically, identified as high or low or within normal limits, and reported directly as such, and it seems it's been that way forever. So again, this setup is very compatible with a structured row and column discrete database. In contrast, welcome to the beautiful world of unstructured text, which, from the standpoint of universal data usefulness, completeness, data mining for research, is chaos compared to the orderly, if somewhat boring database on the right. Now, Dr. O'Toole was trained in a world where diagnostic surgical pathology was entirely analog and the process was highly variable, and I think proudly so, as well as also very labor intensive. As an example, those of you who've been around pathologists for a while know that the pathologist's superpower is their eloquent use of descriptive language when diagnosing patients' tumors. But just like the Justice League, pathologists each express their superpowers differently, and I think we've all seen that. They're gifted in their descriptive abilities, but here's where the problem arises. Two pathologists could describe the same tumor using different terminology. Both could be correct. And in fact, I think they would probably both insist that they're correct. So, a typical old-school pathology report consists of lengthy paragraphs of unstructured text. And it's important to note, Dr. O'Toole was well into his career at a time when the College of American Pathologists was just beginning to advocate for standardization of reporting for some cancers. No electronic cancer checklist was available, and there was widespread resistance to what many pathologists considered to be forced conformity. Nobody wanted to go in and check boxes. The varied use of terminology in these old path reports was so pervasive that even nowadays, when combing through this text to extract data using natural language processing, you get varied and imprecise results. Dr. O'Toole thought that it would pathologists all language by using standard data sets up front to formulate their diagnostic reports for cancer. Moreover, capturing this data as discrete elements dramatically increases the utility of this information for therapeutic decision-making, prognosis, report completeness and accuracy, coding, research, and reporting to cancer registries. He was consistently trying to push from unstructured to structured, from abstract to discrete. Through his work and influence at mTuitive, we developed a synoptic framework for the reporting of diagnoses of cancer specimens using discrete data elements. This has since become the standard of care for cancer diagnosis. We built a flourishing partnership with the College of American Pathologists, and our CAP, eForm, and Expert for Pathology software are now used at hundreds of sites across the U.S. and Canada, and now around the globe. In our transactions with these different labs, we see an opportunity to use this innovative mindset to solve the next challenge for pathology laboratories. Our labs need to be ready not just for the next inspection, but more importantly, for our next patient. The emphasis has now shifted to a continuous process of keeping lab assessments, inspection checklists, and criteria up to date with rapidly progressing technology. You guys know it's no longer good enough to roll out and re-sign last year's procedures for approval. Everything must be constantly updated. This provides wonderful opportunities to automate processes centered around lab inspection and gather and analyze quality data as improvements are made. We need to keep staff skills up to date. Our teams benefit from continual education, and competency is now paramount. So, like Dr. O'Toole, we need to encourage a culture of lifelong learning and improvement. Policy and procedure manuals, binders, spreadsheets for equipment inventory, and occurrence report forms for non-conforming events have all been around for a long time. So these aren't new problems that we're solving, but we hope to bring efficiency and simplicity as well as structure to the process so you can use your lab data to document and improve the quality processes that you're already performing. And in so doing, your periodical inspections should become much less stressful. Now I'm pleased to turn over the program to Dr. Mazzotta.
Thanks, Dan. Good day, all. As Fedra has already introduced me, I'm going to skip over most of my own introduction. I'm going to be giving a very brief overview of a CAP, laboratory inspection. This is going to be mainly geared towards those who are facing their first inspection and what to look out for. I have no financial interest to disclose. However, I do work with Dr. Patrick Garby, and Dr. Garby is the incoming president of the CAP. Why would a laboratory want to be put through the stress of an inspection? Well, CAP inspections are not mandatory, but they are well worth the investment in both time and effort. This is because the Centers for Medicare and Medicaid Services, CMS, has granted the CAP Laboratory Accreditation Program deeming authority, which allows a CAP inspection in lieu of a CMS inspection. It's also recognized by the Joint Commission and can be used to meet many state certification requirements. CLIA, they also have deemed status. However, the big difference between CAP, CLIA, and JACO is that the CAP has pathologists as inspectors. The others do not. We are going to move right along in this presentation. I am going to start with preparing for the inspection day itself, and the post-inspection. Do you remember back when you were in school, you had an exam approaching? Many of you were nervous, probably with some anxiety. How would you feel if the instructor gave you the exam and the answers and then told you, study it, take it home, read it, know it, and then within the next 90 days, you'll have that exact same exam placed in front of you? How many out there will pass that exam? Folks, that is a CAP inspection. It's the exact same scenario. The checklist that you receive from the CAP prior to your inspection is the exact same checklist that the inspectors will have when they arrive at your laboratory. There are no surprises. All you have to do is fulfill all of the requirements, and you will pass a CAP inspection without an issue. The CAP checklist, it is the single best quality manual for the laboratory in the world. The checklist will provide all of the questions and answers that you will need to know when the inspectors are present. It is also, the CAP checklist, it's also the exact same around the world. And just running through a quick example because I don't want to spend much time. In the upper left-hand corner, and I know it's very, very difficult for most people to see, that's a CAP certification from a laboratory in Saudi Arabia. The lower left corner is a CAP-certified laboratory in a hospital in Sri Lanka. To the lower right is the Cleveland Clinic, also CAP-certified, based in London. And in the upper right is Walter Reed here in Washington, D.C., also CAP-certified. And, by the way, mentioning that, the CAP also inspects military hospitals around the globe using, again, the exact same checklists. So we've been talking about the checklist for the last couple of minutes. What are they? They're tools. They are tools used to perform an on-site inspection to increase quality in your laboratory. They are also blueprints to ensure high quality and better patient care. And that is what all of this is about. Increasing quality in your laboratory and better patient care. That is the actual end result and end goal of an inspection. There are 21 different checklists that focus on different laboratory disciplines, and they are, as we've already said, used around the globe. Now, this, and I'm certainly not going to spend much time running all through this, but this is the 2018 CAP checklists. There are 21 of them, starting at the top with ANP, which is anatomical pathology, and there's 200 requirements, otherwise known as questions. All those questions have answers for you, and it runs right down the list through flow cytometry and lab general with 331 requirements. The total requirements for 2018 for a full CAP for anatomical and clinical pathology was 2,927 requirements. Now, if you only have an anatomical pathology laboratory, you will only have a fraction of these. Again, the checklists that you receive from CAP are the exact same ones your inspectors will have. Preparing for the inspection, some of these are the top deficiencies, and I want to make sure that none of you out in the audience get caught. And they're very easily overlooked, and we're going to touch on a few of them over the next several minutes. Competency. This begins on the day of orientation, and it's ongoing during the entire time of employment. This also includes any additional education and additional CMEs. Many PAs and your pathologists also have to have your OPPE or ongoing professional performance evaluation. At our hospital, we do it every 6 months. I don't know what the requirement is for any other facility, but in ours, it's every 6 months. Personnel records, we are going to touch that in depth. Now, the next one is often overlooked, room temperature and humidity. And these are actually quite important. Not necessarily directed towards your personnel, but to the equipment. Temperature and humidity can have a dramatic effect on your equipment, such as analyzers. If the analyzers are affected by the humidity or temperature, the results may become affected. If those results are affected, patient care may be affected, and that is why it's important to have this taken care of. Document control. This is just another name for procedure manuals, policy manuals, which we all have a lot of. They can be paper-based in binders on a bookshelf, or they can be electronic-based and just spinning around in the server room. Either way, they have to be kept up to date. Any old policies have to be archived so they cannot be accessible, and they also have to be accessible to the personnel when they need them. Interdepartment communication. This is another one that's quite often overlooked. How do the departments communicate with each other? How do the different shifts communicate with each other? In our laboratory, we have a simple whiteboard, just a regular whiteboard with a black magic marker. It's on the door, and we have used it for years. It's 12 inches by 18 inches. Nothing so grand. It works perfect, and it fulfills the requirement. I'm going to take a quick look here. This is restricted laboratory access. It's Lab General 59980. Just as I want a few examples here of what you'll be facing. The laboratory has a written policy, so this belongs in your document control, for restricting access to the laboratory. And it has to define how the access is maintained, who is authorized, and how temporary authorization is obtained. Well, the who is authorized, that's usually your personnel. If it is a standalone facility, then it's usually only your personnel. If it's a hospital-based laboratory, then you have the laboratory personnel, but you also have security, housekeeping, maintenance, that are also usually universally authorized. What about temporary authorization? That's also very important. You don't want people just walking around the laboratory aimlessly. Usually they get a visitors or vendor pass, and they're allowed in certain areas of the laboratory, such as salespeople go to a conference room, or maintenance people will go to histology to perform maintenance. And that's how that is taken care of. However you do it, document it, have it signed off, and have it in your procedure and policy manuals. That's what's important here. Safety. Well, we're not going to spend a whole lot on this. We'll touch it again in a few minutes. But most of the people in the audience, they know about the bloodborne pathogens and the fire prevention and the electrical safety. We take tests every year, and we constantly study up on these items. But just as examples for the CAP, compressed gas. If you have no compressed gas cylinders in your laboratory, then all the questions pertaining to compressed gas are not asked of you. It's meaningless. Ergonomics. Is there enough workspace for the employee? Are there chairs in good condition? If the technician is standing, are there anti-fatigue mats available? And chemical safety would be no chemicals. This is a big one. This is another one you have to pay attention to. It's a flag. No chemicals above eye level. Often I have seen people put chemicals on a shelf above their head. They sometimes have to stand on a stool to get to them. No chemicals above eye level. They see it, more than likely you'll be cited for that. No acids and bases in the same cabinet. Personnel. Okay, so this is the number one area where people are getting deficiencies. And we're going to touch on these items on the list because I do not want anyone in the audience to be cited for anything that is on this list. Now, first, it must be understood that the inspector, not the laboratory, selects which personnel records to review. Your inspector may state, I want to see 15 records. It doesn't matter. Pick a number. 15 records of employees. Or they may say, I want to see this one, this one, this one, and this one. That's how it can be done. However, the exception to the rule is that all technical personnel that have been hired within the past 2 years must be reviewed. That's very important. At the top of the list, we have academic diploma or transcript. Even if you're a lab assistant or entry-level personnel with a high school diploma, a copy of that diploma or those transcripts must be in your personnel folder. Pathologists must have, or even in some states, supervisors have to have a professional license. A copy of that must be in your personnel folder. A summary of all your training and experience. This must be in your personnel folder. PAs, and many of your med techs, lab techs, histo techs, all of us really need certification through ASCP. A copy of that certification, usually it's required by the employer, not really the state, but usually the employer, must be in your personnel folder. Now here's the biggie. Description of current duties and responsibilities. This is different from the job description. It is not a job description. A job description is what you can advertise a position for. What you need in the personnel folder is what the employee actually does on a day-to-day basis. That is what's important. That's what people are getting cited. Continuing education. Many of us in PAs, pathologists, and many other certified people have to have continuing education to maintain our certification. Records of this continuing education must be in your personnel folder. The inspectors will be looking for this. Any disciplinary action, they're not going to sit there and read it. They want to see if it's there. And if it's there, fantastic. And last on the list, performance reviews. Many companies are actually moving away from performance reviews. They're simply not doing them, unfortunately. CAP requirements clearly state that all employees need an annual performance review, and the inspectors are going to look for it in the personnel folder. So like I said at the beginning, anyone in the audience, please follow these requirements down and do not get cited for this. All right. Last, before we move on, walking around your facility. I cannot overemphasize this enough. I simply can't. Do not run your laboratory from behind your desk. Get out and walk the laboratory on a regular basis. Look for items that are out of place that could cause tripping hazards, such as boxes or trash. Look for extension cords, which you really shouldn't have in the first place, but if they're there, find out why they're there. Find out if there's a problem that can be corrected. Light bulbs that have been burned out, get them changed. Again, as we've stated before, acids mixed with bases in the same cabinet, or regular administrative trash that's mixed with biohazardous trash. And, you know, we shouldn't really even mention it, but we will. Do not have any kind of candy wrappers or coffee cups in your biohazardous trash. That's absolutely unacceptable. As you're walking your laboratory, use your nose, smell for chemical vapors, smell for biological odors, examine the floors, check your temperature charts and your eye wash charts. Make sure they're up to date. If they're not, find out why they're not. Other specimens, such as histology specimens, are they put away in a vented cabinet in a systematic order? These are very, very important things. It's a very simple thing for you to do on a daily basis. All right. Why did that not advance? I don't know. How about that? There we go. Inspection day. We skipped one. All right, we skipped one. All right. The inspectors have arrived. They will check in with the receptionists and meet with either the medical director, lab director, or whoever has so been designated to meet with them. They'll usually arrive around 7:30, 8 o'clock in the morning, maybe a bit later. Make sure that you have a private conference room available with a large table and chairs, because this will be their base of operations, not only for one day, but this inspection may last multiple days. The team leader will introduce his team or her team to the laboratory personnel and emphasize the purpose of the inspection and the role of the members of his or her team. They will discuss the day's schedule with the lab director and the staff, including the format of the summation conference. The team leader will need to know who should be notified if any deficiencies as they are discovered. Again, there's no surprises. As things are discovered, the lab is notified. The laboratory director, or whoever has been so designated, usually provides the entire team a brief tour of the facility, about 15 minutes, maybe 30, depending on the size of your facility. Also, it's a good idea to point out the nearest restroom to their conference room, since that's where they'll be working for the next day or 2 or 3. With the exception of your first CAP inspection, the CAP inspections will occur every 2 years. The inspectors that arrive at the laboratory will have a complete, detailed documentation of your previous 2 inspections, along with the deficiencies and recommendations that occurred during them. The inspectors will review the correction of the previous deficiencies to ensure that they have been adequately and appropriately addressed. In other words, if you got a deficiency on a previous inspection, make sure that it is completely fixed and addressed before the inspectors arrive again. Read, observe, ask, and discover. So, what do they want to look at first? What do? Nothing. That's what you do, nothing. Take a breath. The inspection procedure is completely up to the team leader. But a good rule of thumb is that they want to spend at least an hour reviewing your documentation, your policies and procedure manuals, and at least 2 hours or so, depending on the size of your facility, walking around the laboratory and asking questions of the employees. The inspectors are in charge of what they want to see, how long they want to see it, and in what order they want to see it. Many times, the inspectors will start at the beginning of a process, say in accessioning, and watch a specimen be received, accessioned, sent to gross, sent to histology, and then on to the pathologists. They can spend several hours doing just these tasks and asking plenty of open-ended questions to any of the employees, managers, or physicians. Now, I'm going to take a sidetrack here because it's actually quite important. An often overlooked area of the laboratory is the slide library, otherwise known as the file room or the slide room, where everyone just sends their slides and they tend to accumulate until someone goes in there and puts them in order. However, no one really thinks about this except the CAP. It must be remembered that those slides represent entries into a patient's medical chart, and therefore this room and those slides are subject to inspection, and they usually are. So make sure your slide file room is in order. The inspectors, they may or may not focus on small details. How small are these details? Well, folks, that's a good question. I mean, it really is. And it's usually up to your inspector. Many times, an inspector will discover something that is trivial and it's easily correctable in a matter of minutes. And if you're fortunate enough to have such an inspector that can either see past this minor imperfection or will allow the laboratory to clear them up while they are still on site, then the error itself is documented as discovered, but it's also documented as corrected, and no deficiency or recommendation will be issued. Now, if you want an excellent first-hand example of this, that I tend to know myself is items under your laboratory sink. What belongs under your laboratory sink? According to the CAP, cleaning supplies. That is it. Not glassware, not equipment, nothing except cleaning supplies. If you have anything else, you open yourself up to citation. Now, if the inspector says, hey, if you can make that stuff disappear before we leave, then we'll let that one go. And that can or may not happen. But from this point on, for those of you in the audience, do not put anything under your sink except cleaning supplies. As problems are discovered, the director is notified. There are no surprises. For every issue that is discovered, the team leader will tell whoever is in charge, the lab director or whoever has been so designated. Now, the lab director will not, or may not really, have an entire running total of how many deficiencies or recommendations are presently being found. However, at the summation meeting, he will have one, and he will be notified so that there'll be no surprises. Actually, at the summation meeting, he will not have any surprises because this will all be known. A typical inspection will be your pre-analytical, such as requisitions, specimen collection, and accessioning. The inspectors, they're going to want to see a real specimen requisition and how that specimen arrives at the laboratory. They will want to know how it was collected and how it was transported. So make sure that you have manifests that available so that they can review them. They will ask for them. They will want to read them. They will want you to point out where that specimen is on the manifest and how it came to your laboratory. They may or may not want to observe a specimen being accessioned, but they can also ask the personnel any question about their duty that they see fit to ask. Analytical, the policies and procedures, safety, proficiency testing, quality control, training and competency. Competency again, touched on that again. These are all part of your analytical processes. But the last one I want to touch on because it's often overlooked in an area of deficiencies. Instrument maintenance and calibration. Now, how many people in the audience calibrate their thermometers that are kept in the refrigerator with a known calibrated thermometer? This must be done on a regular basis. It must be logged that it is done. Analytical balances must be calibrated with known weights, and this is recorded on a log next to the balance. Microscopes must undergo maintenance on a regular basis, and again, that maintenance log must be near the microscope. This is all to ensure quality, nothing else. Safety. Safety is a very large part of the laboratory, and it's often addressed as on-the-spot questions. This is actually interesting if you actually do get to experience it. Pathologists and anyone else that the inspectors can find will just ask questions right out in the open in the hallway. Such on-the-spot questions can occur when an inspector goes up to an employee and says, there's a fire in that room. Where's the nearest fire extinguisher? And the employee has to answer almost immediately. It's down here, it's over here, whatever. The inspector will also ask where the nearest fire escape is. And while they're doing this, they'll also test your security or safety lights by pushing a little button on the bottom of it. So make sure that all of your emergency lights are in working order. They'll also be looking for evacuation routes, your waste disposal, such as biohazardous waste. They'll be checking your fire extinguishers to make sure they're in date. They'll be examining your safety showers, your safety sinks, your eye wash. They're also going to be looking at the logs that should be next to the eye wash and safety showers to see that they've been signed off on a weekly basis. The availability and use, as they're walking the laboratory, they're watching the employees. Do they use their personal protective equipment? Is it available for them? They'll be using their nose to smell for vapors, checking the ventilation of your laboratory. They'll be looking at the lights. They'll be watching for cords or other tripping hazards. Again, it sounds very familiar. They'll be looking in your biohazardous cabinets. And they'll be looking at the workbenches for space, lighting, and storage space. And this is a direct question, is there adequate storage space in the laboratory? It's a yes or a no answer. This is what I don't want anyone out in the audience to get cited on. Post-analytical, reporting is an extremely important topic and another item that's often overlooked. The inspectors will want to see multiple printed pathology reports to review along with the slides that go with the report to correlate both the diagnosis as reported to what is on the slide. Another item that is carefully reviewed by the inspectors is the specimen collection date, the accession date, and the date the case is signed out. In other words, they're looking for your turnaround time. When dealing with clinical pathology laboratories, the critical values are often reviewed, as is the lab information system that provided the reports and the values. Specimen retention. I don't want to skip over filing. Before you establish a protocol, consult your guidelines in your local area and your local accreditation agencies. Remember, specimen retention also includes wax blocks and your histology glass slides. The CAP guidelines for blocks and slides currently is 10 years. Going back up to filing and retrieval of results, that goes back to your slide file room. You have to go back and pull these slides for the reports that they want to see. So your slide file room has to be in order so you can immediately go get those slides. That's why I stressed that earlier. All right, wrapping it up. Any of the systemic problems that I've identified will be discussed with the other team members in the conference room. The team leader will complete a deficiency and recommendations page. This document will be provided to the laboratory director. All right. The summation conference. When the inspection has concluded, the laboratory director and the staff will meet with the inspection team in the conference room. When all the deficiencies and recommendations have been agreed to by the team leader and team members and they are all documented, the laboratory administration as well as the management team are brought into the conference room to discuss the findings. The team leader will explain the various forms that will be presented and explain the findings of the inspection. Each of these deficiencies and recommendations will be addressed to them. All right, the inspectors have left the building. If the inspection went very well with minimal or no deficiencies, then the administration should celebrate this with the employees for a job well done. If there are a few recommendations or deficiencies, then still celebrate. This provides an opportunity for the laboratory administration to know where their weak points are and to strengthen them and correct them so they'll be ready for the next inspection. The laboratory has 30 days to address any of the deficiencies. Once all the deficiencies have been properly addressed in writing to the CAP and the CAP accepts this, the laboratory should receive its accreditation certification within 75 days. Outcomes? Well, while no lab wants deficiencies, finding these weak points and solving them will improve the quality and safety of your facility. And when you have good people and good products, this in turn usually leads to a good inspection. This will also improve the morale of the staff. And this improved morale will be directly and indirectly communicated to the clients and the patients. In summary, walk your laboratory on all the shifts. Read and know your checklists. The laboratory should always be inspection ready. Solve the issues before they're discovered by the inspectors and answer all of your deficiencies. Again, this is peers reviewing and inspecting other peers. This entire process is there to help you succeed and give you and your laboratory better patient care and not to punish the laboratory for any infractions. And that's it. I want to thank Dr. Godby and Dr. Migliosi for helping me out, the folks at mTuitive, and the pathologists. That's it.
That's great. Thank you so much to you both, Dr. Mazzotta and Dan, for your presentations and for sharing your valuable experiences and your insights. We're ready for questions from the audience, and we've had quite a lot in, so we'll try and get through as many as we possibly can in the time that we have available. Audience members, still feel free to submit questions to us. Our presenters will do all they can to respond to those questions live now during this webinar. But I want to assure you that any questions that are not answered today live, they will be answered via email. So please just feel free to continue submitting questions throughout this webinar. Okay, so I'm about to get the Q&A underway. First, a question then. So what do you both believe are the best ways to stay up to date on requirements and regulations put forth by, say, RCPath, CAP, CLIA, and others?
A couple of suggestions that I have on this, and then Dr. Mazzotta, feel free to jump in, is one is appoint somebody in your lab to be in charge of this activity. If you're a small lab, this can be a part-time person or even a part-time activity for a person in your lab. And this might give you an opportunity to reward a team member who's interested and motivated to get involved in this. And also make sure that if you do that, additional recognition comes with that added responsibility for that person. You can ensure that the person that's involved in this is connected with your accrediting agencies so that they can receive notifications, e-alerts, training opportunities, and particularly you want them to stay abreast of news through professional organizations like AACC, COLA's Lab University or IQCP, CAP or ASCP. I think it was pretty abundantly clear in Dr. Mazzotta's presentation. Get the CAP checklist, and CAP members can download this from the website. And believe it or not, too, I guess there's two phrases you kind of get skeptical of, is the check's in the mail, and I'm from the government and I'm here to help you. But if you're in the U.S., there is actually a government website, cms.gov, and you can sign up for email updates, and it's actually very helpful. Anything to add, Dr. Mazzotta?
No, actually, I concur very well with that. You gotta remember, places like the CAP and ASCP, they are there to help us or help you succeed. And they have a team, especially CAP, they have a team of experts who, if you have an issue, you call them up and they will solve the problem for you. All you have to do is just do basically what they tell you. Or you have a question, say, what's the correct temperature for whatever. More than likely, they will have an answer for you and can be able to cite a reference for that. Again, they're all here to help you. The other thing you should understand is when you're having a lab inspection, this is a peer helping peers doing this, so that the inspectors that are at your lab, you may be in 3, 4, 5 years, you may be at their lab inspecting them. That's how it works. It's as easy as that.
Yeah, that's a great point. Thanks, Dr. Mazzotta and Dan. Actually, and the question we have here is about it's asking for a recommendation for a good system for determining how much time or priority should be given to preparing for each element of inspections. Do you have any recommendations in that regard, Dr. Mazzotta? We'll start with you.
The laboratory should always be as close to inspection ready at all times. But as long as you go and walk the laboratory on a daily basis, talk to the employees, find out if there's any problems. More than likely, it'll be solved en route during the time. It really shouldn't be a crunch to the finish line. Oh, the inspection window is here. Let's push it. Oh, they didn't come today. Let's do some more. They didn't come today. Let's do some more. No, it should always be all done so they can just walk in the door. And again, you'll have the checklists, and suppose you wanted to, say, take care of your flow department, your flow cytometry. Use the flow checklist and have them go through the entire checklist themselves. If there's any issues, you can either solve them or have a designated person solve them, or call the CAP and have them work with you.
I can add a little bit to that, and part of this is to amplify what Dr. Mazzotta said is we always do self-assessment in between and share the results of the self-assessment with your staff and solicit feedback, and that will give you an opportunity to identify how much time or priority should be given. Your department supervisors know very well what it takes to run their particular departments and can give you excellent feedback. Also, it's an opportunity to incorporate preparation into routine lab practice for your quality initiatives. And then as you do that, you can track time and resources that are needed, particularly for your self-inspections, which are a nice practice run. You can do an abbreviated trial run, get an idea of the current status as well as the time needed to ensure readiness, and use that information to determine what your time and priorities should be.
Yeah, great. And as somebody who's actually responsible for ensuring that the laboratory is inspection ready, how do you think, what's the best way of communicating the resource that you need for inspections to lab and hospital personnel, do you think? Dan, we'll start with you.
One of the things that I think is important is to document things. Make sure that you keep documentation of what you're doing to prepare for inspections. Keep track of the resources that you need. You can do some of that by reviewing results of previous inspections, which you have to do anyway, or your mid-cycle evaluation, and also take a look at the consequences of your previous inspections, the time needed to correct deficiencies. Evaluate employee morale if you're dinged. It's not always a dollars and cents issue. Employee morale in this is very important. You don't want people to burn out, and be able to present this, collect this information, document it, and be able to present it to your leadership. The other opportunity is to invite participation of your leadership for a portion of your mid-cycle evaluation so they get a first-hand impression of what resources are needed and, how labor-intensive is this process. and also be able to identify for them things that are non-negotiable, and impress on your leadership that there are certain things you don't have a choice, you simply have to do, like proficiency testing.
Yeah, yes, that's spot on, and that's exactly correct.
Yeah, I mean, involvement of staff, other members of the team. We've had more than one question on that issue, and you have kind of answered that, Dr. Mazzotta. Any other addition that you'd like to make on how to best involve your staff in the ongoing preparation?
The staff should always be involved, and of course these, especially your entry-level personnel, the like sessioning people, these guys are right on the front lines, and they can tell you if there's any problems, even problems coming from your clients or other physicians. They can also tell you about quality issues that are coming through with your specimens, and this will give you a heads up so you can attack these issues before they become a real big problem. And you use this mode of communication back and forth to solve the problems as you go along. And these people will all of a sudden become involved in this, and they're going to want more involvement. And it actually really does blossom into something nice, and you end up with a really good team. And that's pretty much all that there is.
Yeah, sure. And actually, from another angle completely, someone's asking here, as a junior pathologist interested in lab management, how do you think what tips can you give for them to become a successful CAP inspector? And any suggestions? Dr. Mazzotta?
Did they want to become an inspector? Is that what?
Yeah, absolutely.
If they want to become an inspector, that's very, very easy. If you go to the CAP website, there's an item that you can click to become a CAP inspector. Since it's a pathologist, it'll be a team leader. There is no charge for this, and there's a test you take at the end. I think you have to get 70% or 80% on it, and then they'll send you your certificate, and you are a lab inspector, just like that. And then you'll go out several times on a team to learn the ropes, and that's it. And then you're cut loose by the CAP, and they'll send you to a lab as a team leader. Now you have to remember, inspectors are usually regional. They're usually within driving distance of your laboratory. So within, say, 2-3 hours of driving. So here in the South, you'll have maybe somebody home in the Southeast, not somebody from Washington State. So you end up with local people too.
Yeah, sure. And we've had some questions from people who are outside of the US, and I'll go with one here asking, for ex-US laboratories looking for CAP accreditation for the first time. Would CAP ask for certain remedies of first PT survey deficiencies, if any? What's your knowledge on that? Dan, maybe, are you able to answer that one?
Actually, I think I'll need to defer this one to Dr. Mazzotta.
Sure.
I'm not really sure from outside the country.
Unfortunately, Dr. Mazzotta is also the same. He may have to defer this to CAP and have them actually answer this one. But the best answer is, call the CAP up, and they will give you all the information you need. Now, you have to understand, an international laboratory who gets inspected by a U.S.-based pathologist, they will have a date. This will not be a surprise inspection. Everything will be arranged on a certain date. The U.S.-based inspections will have a window of 90 days and will be a surprise inspection.
Sure. Thank you for that. We're actually, we're kind of almost up to time. We do continue to get questions in though. So I'm going to ask one final question, if I may. And this is about fire safety. Dr. Mazzotta, in your presentation there, you did mention fire safety, proper placement of fire extinguishers and the like. During inspections, are there also going to be tests and checks for smoke detectors and whether they work properly as well?
I have never actually had an inspector test a smoke detector. They pretty much know that they're there, but I never actually had them test them in all 30 years of experience.
Okay, well, thank you so much. I mean, any thoughts to add on that, Dan? Any experience yourself?
No, actually myself either. In fact, I'm trying to picture what we would do in that situation, and I'm not really sure either. I haven't experienced it.
Yeah, sure. Okay, actually, I'll just finish on one final question. Someone else is referring to mTuitive. The audience member is asking, they know that mTuitive is known for their synoptic reporting solution. Is that part of the solution that you're speaking about today? He asked. Dan?
I'm sorry, could you repeat the question?
Yeah, one of our audience members is asking, he's acknowledging that mTuitive is known for their synoptic reporting solution. Is this part of the solution that you are both discussing today? So both yourself and Dr. Mazzotta, are you incorporating your that solution into your presentations today? He's asking.
Yes. Yes, we are.
Great. Nice and simple. That's a great way to end this. We do actually have a bunch more questions that we could have gone through, but we are all out of time. So I just want to assure you all again, to those of you who have submitted questions that we haven't got around to asking live today, those questions will be answered via email after this session has taken place. So please look out for that. But that's all we have time for. The time has flown, and that's just testament to the exceptional presentations delivered and to Dr. Mazzotta and Dan as well for giving brilliant and very highly engaging presentations. So I'd just like to thank you both for your time today and for sharing your valuable insights with us. I'd also like to thank our audience members for joining us today. Thank you so much for giving up your time to listen to this webinar. I really do hope, or we do hope, that you enjoyed it and that you found it very helpful. Just to let you know that this webinar will be available on demand within the next couple of days, so please look out for that too. You'll be able to download it and listen to it at your leisure and share it with others who may be interested. But for now, on behalf of the pathologist, it's our absolute pleasure to have hosted you today. Thanks to Dr. Michael Mazzotta and to Dan Faasse and to mTuitive. And I look forward to seeing you at future webinars. So thank you so much and goodbye.